afternoon. Welcome to Community Health Watch. I'm your host, Gail Lewis. When I think about my senior golden years, I think of myself on a beautiful yacht off the coast of Florida with the wind blowing in my hair and a cold drink on a hot day, enjoying my retirement. That, unfortunately, is far from the reality for many seniors. According to the census, over 20% of seniors right here in New York City live below the poverty level. And when you consider that the poverty level is only $11,670 per year, it seems as if that number, 20%, should be a lot higher. So joining me today to talk about the elderly and poverty is Maria Alvarez, Executive Director of the New York State Senior Action Council and the Brooklyn-wide Interagency Council of the Aging. Welcome, Maria.
Thank you so much.
I think about poverty, and the actual poverty level is about $12,000, $11,600 and change. So I think about all of the elderly people right here in Queens, right here in New York City, who live below the poverty level of $12,000 approximately per year, and that's 20% of seniors?
Right. According to the census, the federal poverty level, that there are 20% of seniors that live below that federal poverty level.
So that's 1 in 5 seniors.
1 in 5 seniors.
But when you consider that $12,000 a year is not a lot of money.
No, it certainly is not a lot of money, especially here in New York City.
And also you think about all of the seniors in the population who just make above that poverty level. So the ones subsisting on $13,000, $14,000, $15,000 a year who aren't included in that 20%. The numbers are actually just staggering.
They are. They're staggering. And one of the things that we find is that there are some benefits and programs that are available to seniors and to the general population within certain income range. And what we have found is that if a senior is not accessing one benefit, they are leaving generally $2,300 on the table per year in benefits that they could have gotten in order to be able to be able to subsist.
And when you talk about benefits, what are you talking about?
Well, we're talking about nutrition services. It could be transportation. It could be health care, prescription drugs, housing, heating, things like that. Sometimes people do not access these services because they don't know about them. They don't know that they qualify for them, or they don't have access to centers where they can get that type of information.
Oh, that's amazing. So I look at the Elder Economic Security Index. Can you explain that to us?
Yes, the Elder Economic Security Index is a project, a national project that we have partnered with the Wider Opportunities for Women.
Or WOW, W-O-W, right?
Yes. And what we did is we calculated the average cost of certain things such as housing, food, and these are all conservative numbers, not that you're going to go out to a restaurant, but that you're buying basic food in the supermarket, transportation, insurance, housing, and so we added all of those up, and we calculated it on a county-by-county basis, and we also found out whether you're a single person, a single elderly person living in a one-bedroom rented apartment, whether you're a single person with a mortgage and a homeowner with a mortgage, or a homeowner without a mortgage, or whether you're a couple with all 3 of those categories as well.
And you not only get specific using the population, but also specific in the areas. You guys went county by county.
County by county, yes. And because the federal poverty level, for example, assumes that everybody will spend a third of their income on food, a third of their income on housing, that everybody is in great health or in the same health, and it doesn't matter whether you live in New York, whether you live in Queens, in Albany, in California, it doesn't matter where, they keep that constant number. Well, we have found that there are big discrepancies, as you can imagine,
right.
And I know I don't have to say, but there are very big
between
discrepancies.
a one-bedroom in Queens and maybe a homeowner in Iowa.
Right, exactly. Or even one bedroom in Queens and one bedroom in Iowa, you know, and depending on where, and county by county. Looking at that type of, looking at things in, you know, from that perspective, we found that in New York City, it's really a third of the elderly population, you know, by those standards, that are living, that are not making ends meet.
Wow, a third?
1/3.
So 1 out of every 3 is fledgling elderly people.
Yes, we're talking about food insecurity, people, you know, people who have a lot of you know, high rents, you know, the rental and housing, unaffordable housing is a big issue. Prescription drugs and health care continues to be one of the reasons why people go into get into bankruptcy or fail. You know, so those are all things that we find those costs of, the cost of living is going up, but the inflation rate is going up, but the cost of living adjustment that the seniors receive in their Social Security checks is not making, you know,
it's not keeping par with the cost of living. And also the federal poverty level has been at about $12,000 for years.
Right. It sort of goes, it edges around that area.
Yeah.
So
I mean, the cost of living, if you just consider the last decade or the last 2 decades, has gone up exponentially. Yet the poverty level has always been kind of hanging around $12,000.
Exactly. And for example, with Social Security, the you know, when the seniors get the Social Security beneficiaries get their cost of living adjustment, in this past year, actually, the increase of Medicare took over much of that.
Really?
So that they really didn't see that much of an increase, the little that they had in their checks.
So the cost of living adjustment was about how much of a percent?
I think it was 4%,
and then that was immediately eaten up.
Right,
by Medicare costs.
So it's something that that people, you know, don't fail to realize, but for seniors it's a big issue.
They're pretty much robbing Peter to pay Paul at that point.
Right.
Yeah.
Yeah, exactly. This is one of the first times that we've seen senior citizens with credit card debt.
Really?
You know, because they cannot make ends meet on what they have.
And I'm sure they're not going out buying luxury vacations. They're probably buying groceries.
Right. It's just day-to-day needs.
Yeah, basic needs.
Basic needs. And so it's you know, and again, when we have such a discrepancy and such a gap with, you know, New York City is one of the wealthiest cities in the world when you look at the amount of money that, for example, Wall Street brings in.
Right.
And then we have the middle income is thinning out quite a bit, and then the poverty rate, you know, and the poor people are not are getting a lot poorer.
Right.
So yeah, so that's an issue.
So let's say that you are, the poverty level is about $12,000, and let's say that you're an elderly person whose annual income, which is fixed generally, is about $15,000 a year, which is not a lot of money to live in New York City.
Right.
Would you qualify for all of the same programs that, let's say, someone who fell below that poverty level of approximately $12,000 would qualify for?
Not necessarily. You would qualify for all of those the programs, but there are programs that the person would qualify for. For example, we would have, let's say, food stamps, which is SNAP now. Many of the people, and the problem is that sometimes it has a stigma. So sometimes people will even say, "Oh, I'm not going to take that, and why would I take it for $10 or $20?" But the reality is number one, the person probably needs it.
Right.
You know, number one. But number two, we always talk about this. If people do not access a program or a service, then those will be considered underutilized by the government and by policymakers, and then we will see those benefits disappear.
So those benefits would actually be reduced or disappear.
Right, because they figure, well, people
People
don't want it,
them.
they're not going to use it, they must not need it. And that's, it's a fallacy because people actually need it, and many times, it's hard to get to some of those, to qualify for some of the things. So that's why people don't access them, but we have to do a better job in making sure that more people have access to this type of information.
Is there anything we can do to make sure that these programs are open to more people?
Well, education and information is always the biggest way to get things out.
Right, so making sure that the elderly knows what is out there for them to help them, to assist them.
Right, exactly. And just to give you, an idea, in New York City, it costs about $29,000 on an average for a senior citizen to live. And a lot of people will say that's a very small number.
I was thinking that's pretty conservative,
right? It's very conservative.
$29,000.
Right.
I mean, your rent alone.
Exactly. Again, these are very, conservative, and it's an average.
Right.
So if we consider that the federal poverty level is less than $12,000, and a person needs $29,000 just to be able to live in the community, how are we going to be able to make up that difference?
Right.
It's a $17,000 difference. And the answer is with all those benefits and programs that exist. The affordable housing, rent, Section 8, the senior citizens rent increase, exemption. All of those are things that if a person accesses them, then they'll be able to build up to the point where then they could stay in the community.
Right, and I've seen those numbers, that $29,000 number, which is approximately how much a senior needs to get by in New York City. Those numbers are very conservative. I think it's like $330 for food per month.
Right.
I mean, they're very basic.
Very, very basic. Yeah. No, and it's an average, and of course and what we say, it's a conversation starter. We could probably, it's something to start, because what the reality is that when budgets pass at the state level, when the elected officials start proposing cuts to different programs, those programs are the ones that are first on the cutting block.
The ones that are underutilized, the ones that
Well, the ones that keep you in the community,
right.
When somebody says we're going to cut, or even at the federal level, we had a huge battle just until recently with the Farm Bill. I'm sure a lot of people heard about the Farm Bill.
Yes.
And it was because we're not farmers here in Queens, but the nutrition funds were tied into that Farm Bill.
Right.
So in order to get, that represented millions of dollars that New York State would have lost for the nutritional
assistance program,
right,
food stamps, right?
Exactly. So we would have lost all of that, and happily enough, our coalitions and everybody built up a great defense, and we were able to get that back, and reinstated. But it would have been a travesty. And these are human basic needs.
So. How do the electeds overall stand on this issue, on the poverty issue with the elderly?
Well, in New York State, I think, especially on the federal level, and in the state also, we're very lucky that in New York State we have very good health care comparatively to other states. Yes, but we, obviously more can be done. So, we never say things are perfect, because they're not.
Right.
But when we compare it to other states, we see how other states fare. We do a lot. We have much more understanding elected officials. However, there are certain things that we would like, certain improvements that we would like to see, and we still continue having those conversations with the elected officials.
And those improvements include?
Well, one of the great things was that the EPIC, which is the Elderly Pharmaceutical Insurance Coverage, we were very, very happy to hear, or to realize that in this past state budget, which begins April 1st, 2014, the thresholds were increased.
So the thresholds for
elderly insurance, the EPIC program. which increased for a single person up to $75,000. So it went from $35,000 to $75,000. Somebody could qualify to receive that coverage once they hit the donut hole, and their insurance company, you know, would have paid for the insurance for the drugs. So the EPIC would wrap itself around, is what we call it, to make sure that the senior would not have to pay for it.
And just explain the donut hole. That's a term that you always hear when you talk about Medicare, when you talk about seniors, when you talk about healthcare costs. What exactly does that mean?
Well, the donut hole is basically when a senior spends all of their has drug expenses up to a certain amount of money. This year it's $2,850,
which is not a lot of money.
Right. I mean, depending on what your health situation is. If you're on 2 or 3
meds and they're brand name meds, you can easily exhaust $2,800.
Right. So once the person falls into that, so we call it the donut hole, because that's when the health insurance company stops paying for, you know, the Part D program starts paying for the medication. So then it's up to the senior to pay another $2,850 to then get back and out of the donut hole, and the HMO would then pay 95% of the cost from there on.
Wow! So you've got to spend. So once you exhaust your initial $2,850, you're responsible as the senior for the next $2,850.
Right.
And then after that, you'll go back into the program where they pick up 95%.
And they would pay 95%, which could be more than what you had before.
That really is a donut hole. It's like a morass you just kind of fall into.
So EPIC would then wrap itself...
And that's the elderly pharmaceutical insurance coverage.
Right. Would then cover, so the senior would pay, you know, the $20 for the prescription, but then EPIC would assume everything else, as long as the HMO would have covered it, you know, that prescription drug.
And prior to April 1st, 2014, if you made more than $35,000 a year, you would not
qualify as a single.
EPIC.
Right. And in for couples, it was $50,000, but now it's $100,000.
That is huge. That just opens it up from $35,000 for a single senior to $75,000, because I'm thinking if you're making $38,000 a year, you're just above that cusp,
just over.
But you really need that coverage.
Right, exactly.
And then for couples, $50,000, I mean, $50,000 is a lot of money, but if you're making $51,000, $55,000 and you're in that donut hole where you're paying for your meds, you know, between you and your husband, if it would be a couple, and you're each on 2, 3, 4 meds that are brand name, you can easily easily exhaust your $2,850.
Right. So so we're very happy that's happened. Now another thing that we would like to see, though, is to be able to that the legislature would expand this coverage to people who are 64 and under and disabled, because the disabled community, they have a lot of medical expenses and especially prescription drug expenses. And with the savings that we're providing EPIC by, you know, because the Affordable Care Act is actually, that donut hole is shrinking over the next 10 years. So,
but right now that doesn't help you.
Well, well, the thing is that the state EPIC is paying actually less money for that for those medications, so there is a savings there. What we would like to see are those savings to be utilized either for the aging services, or, but better yet, it would be great to have the disabled community to be covered by this program, which is only a New York State program. We're very proud of it.
Oh wow, that is huge.
Yes.
Who in the Assembly, who's really helped you out with all of this? Who, as far as our state and our federal politicians?
Yes, well, for these bills, Senator Hannan and Senator Gottfried, I mean Assemblyman Gottfried, excuse me, are the chairs for the health committees, respectively. So they've been very good at vocal, and they understand the needs for seniors and the importance that these things have in their lives. So,
anything else on that wish list?
Yes. Well, we have a few bills that we would like to see or passed. Some of them, one of them would be an increased increased money for the congregate services. The
congregate services, what are those?
Yes, the congregate services are funds that are allotted for seniors in the community to be able to stay in the community. So there's money for the ISEP program, which is the Elderly In-Home Services program, which is basically home attendants that come to the house, so that a senior in need of certain activities of daily living would be able to get assistance.
Stay in their home and get assistance instead of moving out of their home.
Exactly, and you know, congregate services in the kitchen, you know, in the senior centers, you know, meals in the senior centers, transportation, all of those things. Right. Yes, our congregate services, and we were very happy that we got $5 million more for the entire state.
Wow.
The problem is that we were asking for $26 million. It's a start. We're happy.
We got a fifth of what we asked for, right?
But you know, the issue really is that New York State is a graying state, and New York City is a graying city.
So we are getting older as a population.
Right. So, for example, in New York City, by the year 2030, there will be more senior citizens than children in the population.
Really? Okay.
Yes. So what we always call on is for the elected officials and for government to have the infrastructure. We need to make an infrastructure that is senior friendly.
Right?
Yes, exactly. Which would include not only, you know, services but physical things. You know, like ramps, more ramps, more accessorized, you know, better accessorized actually.
Even at the end of at the end of the street, you know, there a lot of times the sidewalk just kind of dips right down. I think about people who are walking with canes or walkers. If since our elderly population is increasing, we need more things like that.
Right. Well, it's funny that you mentioned that, because at one of our chapter meetings, we have chapter meetings every month, one of our members was saying that with all of this snowstorm, the snow banks were covering the areas where they could roll into the bus terminals.
Right.
So it was very difficult for many of the seniors to actually access transportation during that time, because, you know, it was covered in snow.
I mean, unless you were sitting out in the street waiting for the bus, or
you're going to get run over by a car.
Yeah, it was very difficult.
Yes,
even difficult to navigate if you're not senior.
Right.
So I can't imagine needing the assistance of a walker or a cane or something and having to navigate.
Exactly.
Yeah.
So yes, so that's so all of our advocacy really is towards making New York a more friendly, an age-friendly state, because it's the reality, you know. And the other thing is that the younger seniors are,
who are what age group?
You know, they're baby boomers that are aging in, so they might be 62, 65, and the ones coming up, you know, coming through, are going to be not going to have the same benefits, the job benefits like pensions and savings that the older seniors today enjoy. So it might be a population with less income. They might be of different nationalities.
Fewer assets.
Fewer assets, fewer educational attainment, which also connotes poverty, larger poverty. So there are more challenges that will need to address at that point. So a lot of our advocacy really stems around preparing for those times.
Because if we don't fix those problems, and this is a whole new population of seniors who are just aging in, who are going to be in poverty.
Exactly, and they may have also different health issues or more health issues. Exactly, and they're going to be poor. A lot of people are maybe poorer than the seniors that we have now.
Wow.
And especially with the cost of living that is still going up. So we need to really work on trying to fix those issues.
If people want more information about the elderly and poverty and all of the programs that you mentioned, they can call your toll-free number?
Absolutely. They can call the 1-800-333-4374.
And that takes you to statewide?
To New York Statewide Senior Action Council. And we have excellent counselors there that would be able to help with whatever they need. We also do presentations in the community on a myriad of issues, and we would love to be able to see more people.
And do you usually do those at senior centers or local community centers?
Wherever we're invited.
And also people can find you online where?
At www.nysenior.org.
And WOW, that organization you talked about, women?
Wider Opportunities for Women, which is wowonline.org, which is a wonderful organization. They're based in Washington, D.C., and they also have a lot of information on family economic security as well.
Okay, so how you, not only as an elderly person, can be more economically secure, but also
as a working person, because, for example, they have a study, the Family Economic Security Project, and what they have found is that in New York State, a family of 4 would need about $80,000 to be able to not only, you know, be able to live in New York, but also to make all of those, you know, to put money aside for their children's education, for savings in the future, and to be able to make sure that when they become elderly, that they are secure as well.
Right. I mean, if you are not making enough money right now and you're not elderly, then you've really got to think about that. Yeah, catch up somehow.
Yes,
absolutely.
And that is becoming a larger challenge as companies, you know, don't have
traditional pensions.
Right, exactly. Or pensions, or, you know, 401ks, and a lot of those incentives are.
Or any of those automatic kind of savings programs that we had 2 generations, 1 generation ago.
Exactly. And another issue that we're finding is, as banks leave the bricks and mortars, you know, they're not really banks anymore, but a lot of people are going to e-banks, you know, banks that are not in your community. It's also they're also offering less products that would encourage a person to save and put aside, or even, you know, for the future. We're finding still a lot of redlining. Redlining, meaning that in communities of color, they are not lending, you know, doing mortgages or lending capital for business and economic development at the same rate as other neighborhoods. And also the mortgages are not as advantageous as you would find elsewhere.
Lots of things not advantageous when it comes to poverty and the elderly. And that's what we discussed here today on Community Health Watch. Thank you, Maria Alvarez, for joining us. For more information, go to wowonline.org or nysenior.org, and of course call Maria, 1-800-333-4374. I'm Gail Lewis for Community Health Watch. Thanks for watching. You can always email me, newday2010@yahoo.com, for more information. For everyone here at Community Health Watch, thanks for watching, and we'll see you again real soon.